One way to help us get a sense of the effectiveness of public policies in the United States is to compare well-being here to human welfare in other countries. The United States is clearly an outlier, and not in a good way, I'm afraid to say. Americans fare worse across a broad range of measures than do people in other rich democracies. So what we're looking at here is rates of poverty, and that's the US in the red dot there under that red arrow. So among all of those countries, right, 38 in the Organization for Economic Cooperation and Development, only one of them has higher rates of poverty. This is now looking at child poverty. It's not quite as bad, but every country to the left of that arrow has fewer children who die before reaching their 18th birthday. This is now elderly poverty, higher only in the 7 countries to the right of the arrow. We're now looking at infant mortality rates, or how many children are born but die before they reach their first birthday. So it's not quite as bad as it is for poverty and child poverty, but once again, look at all the countries that have lower rates of infant mortality than we do, or the places where people have a better chance of surviving after being born. This is now the other end of the spectrum, life expectancy. Here, every country to the right of us in red fares better than we do, or people live longer on average. We're now looking at suicide rates, higher only in the countries to the right of the red arrow. And yet, given all of that, here's this weird, curious fact. For all these unfavorable outcomes, we spend more per person on healthcare than anyone else does. A lot more, as you can see here. This is also, by the way, a really good hint that when we are trying to evaluate policies and programs, we'll have to look at more than just how much money they spend, since that won't necessarily tell us whether they are effective or not. So we're now looking at income inequality, lower in all of the countries to the left. And then here's the thing that I think people will find most surprising. We not only have higher rates of poverty and child poverty and infant mortality and lower rates of life expectancy and so on, but we also have lower rates of mobility too. So now this, of course, cuts against the core narrative of what the United States is supposed to be, right? The land of opportunity, the streets are paved with gold, work hard and play by the rules, and anyone can grow up to be anything they want to be, etc., etc. This is not true. There's more economic mobility in every one of these countries here. Put differently, if you are born poor in the United States, you are more likely to die poor than if you were born poor in any number of nations in Western Europe or the Nordic countries. But why, right? This is one of the puzzles that we're going to try to solve at least a little bit this semester. But at some level, the answer is not really all that complicated. We have more poverty, for example, because we have fewer policies in place to reduce it. Let me show you what I mean. So take a look at this bar chart and start by looking at the blue bars. This is what is sometimes referred to as pre-transfer poverty or market poverty or natural poverty, a phrase that I'm not super fond of. But it's simply a measure of how much poverty there is in a country before we take into account the effects of things that governments do to reduce it. So you can think of this as how much poverty the economy creates on its own. And as you see here, right, we're actually not an outlier when we look at this pre-transfer poverty rates. In fact, the United States rate of pre-transfer poverty is even lower than in some countries, lower than in France or Germany, Australia, even Sweden. But now look at that red bar. That's the post-transfer poverty rate, or the real poverty rate, we could call it, right? This is how much poverty there is in actuality once we factor in all the things that government does to reduce it. And this is when we become the outlier. It's the same idea here, only now we're looking at pre- and post-transfer rates on inequality. But it's the same pattern. Right? Why do we have more inequality? At some level, it's because we have fewer policies in place to reduce it. So here's one way to look at that post-transfer anomaly. This shows total government expenditures as a share of the total economy. The government in the United States spends less. therefore does less. This is now comparing us just to the Nordic countries, right? You can see that difference. This is not new, it's worth noting, and you can see that here. So that's us in the black line showing just cash welfare expenditures compared to some other countries since 1800. Right, this is a long-standing pattern. But in some ways, all of that just restates the question, right? Why? So why do we do less? And as we'll see, even what we do, we do differently. We depend more upon the private sector, for example, and upon means-tested categorical programs rather than the kind of universal ones everyone is eligible for in, say, the Netherlands. Those are programs that distribute benefits broadly to everyone to prevent poverty. We don't have too many of those. Instead, the United States tends to allow poverty to happen and then sometimes tries to reduce it after the fact. But again, this is the puzzle, right? Why are we so different in these ways? And it's one that we will spend a good bit of the semester exploring.